And Dr. Fair is joining us this morning. First of all, Dr. Fair, I got to say it's so good to see your face. How you feeling?
I'm good. I was downgraded from critical last night, so obviously a good sign.
We should point out, Dr. Fair, we said you're 42 years old. You run, before all this, 5, maybe up to 10 miles a day, a healthy guy. You hop on a flight going to New Orleans, and you said something that just struck me. You said that you think you might have gotten it, since you were all masked up, through your eyes. Tell us about that.
That's one of the 3 known routes of getting this infection that we just don't pay a lot of attention to. We tend to focus on the nose and mouth because that is the most common route. But, droplets landing on your eyes are just as infectious. And, of course, I wasn't wearing goggles on the flight. And I think Savannah reported yesterday, but it was very true. Airlines, they said they were social distancing, but they really weren't on my flight at all. And instinctively, I probably should have gotten off the flight when I saw that. But they had us packed in like sardines, and definitely not ideal, when you're trying to combat a pandemic and trying to slow it down.
And you did, though, you said you had on your gloves, you had all the Purell, you were wiping everything down. So even with all those precautions, you're pretty sure that's where you got it?
I'm pretty sure, because I went directly home and I didn't really go out after that. So I'm pretty sure it was the airplane, and I developed symptoms 3 to 4 days later, which is typical for COVID-19 infection. So epidemiologically, it's the best guess I can give.
So you get home, you suffer kind of a loss of appetite for a few days, and then you start then you start getting other symptoms. How bad did it get, Dr. Fair? And at what point did you say to yourself, I got to get myself to the hospital?
Well, as we've been saying to everybody, if it seems like a cold or a flu, you can treat it at home. Don't overwhelm the system. And I would say it felt like a, moderately severe flu for the first week. And it started on about a Monday, my symptoms-wise. And by Friday is when I started noticing that my lungs were becoming involved. And, that's typical with COVID-19, that you develop kind of a walking pneumonia, which is a secondary infection as a result of the virus, which is bacterial. And that progressively got worse over a few days. And by Monday, I really couldn't take, I was probably getting about 25% of the air I was trying to take in, which is a very anxiety-provoking feeling.
Oh, my gosh, I would say so. You called the ambulance, you get to the hospital, and you were mentioning to me that you were maybe like a day away from being intubated. How did you turn the corner?
When I came in, they asked me if I wanted to be intubated. I really said no, not unless I absolutely have to be. I'd rather try oxygen first. And so they gave me a higher volume oxygen mask. And I did that for the first 24 hours with some additional treatments for my lung infection and so forth. And I really showed dramatic improvement over 24 hours. And then the next day, more improvement. The next day, more improvement. And then last night, I was downgraded from critical. So I've responded well to oxygen treatment along with heparin and the other drugs that they're giving me for my lung infections.
Dr. Fair, something I didn't get, I didn't understand, was you were tested 4 times for the coronavirus, and every time it came back negative, but clearly you have it.
Well, there's a couple of things that might be. I waited a week because I was taking care of myself, and virus kind of naturally drops off in your system after some time, but your body's still going to be dealing with the after effects of what it did when it was there. That's what we call the cytokine storm. It's the secondary bacterial infections. So it's a possibility that, my what we call viremia, or the amount of virus in my blood, was undetectable. That being said, I did learn that, these tests are by far and away not 100% accurate. I had the Abbott twice, and my local caregivers told me that they were getting about 50% false negatives and mostly false negatives with that. I tried the 2 PCR tests that, of course, the White House mentioned several months ago, both negative. I tried the BioFire, which we've been using in New York and around the country. It's a really excellent device, but negative there too. And so my only explanation is, well, I think it's a combo. I think our tests are still very imperfect, and we're missing a lot of cases because of that. And I think also, I waited a bit of time, so there's a good possibility that there was just no detectable virus still in my blood system.
Boy, and we keep having the discussion that we need more testing, and then, what you're telling us is so often that testing doesn't even work. There are a lot of people who are young, they're your age, they're healthy, they're walking around, they're saying, ain't going to be me. What's your message to people who are watching today?
Everybody can feel that way, and I honestly was somewhat at the peak of health in my life, and I was a very healthy person. I can, like you said, I can run. I exercise 5 to 6 days a week. And if it can take me down, it can take anybody down. That doesn't mean to say it's going to kill you, but it just really, you don't want to have it. That's all I can tell you. And you don't want to spread it on to anyone that is at any point at a high risk, because, looking at me healthy and exercising and all of that, I can't imagine being someone with a high-risk condition. In fact, in the ICU, I was literally the only patient not intubated. And my caregivers told me I was the only one they were able to speak to, because I was the only one not intubated and kind of in either induced comas or just intubated and couldn't speak. So I've been very lucky.
Well, we are just, I got to tell you, Dr. Fair, we're so happy you're on the mend. We can't wait till you get better and you can come back and see us. So take good care of yourself, okay? And we'll see you soon.
Thank you, Hoda.
All right, Dr. Fair, thank you.
My goodness.
Wow.
I tell you, if that virus can strike a guy like Dr. Fair, it can strike anyone. And to hear him talk about not 1, not 2, not 3, but 4 false negative tests, that's scary.
Yeah. It's really shocking. I mean, the whole story, how it all developed. But again, it's a cautionary tale, and we're so glad he's doing better.
Yes. Yes, we are.